This will be a session covering the face sheet. The face sheet is unique to each login, so each user can have a unique view of the face sheet and unique view of each patient's chart without impacting other person's views. So the setups that you have and the preferences for your face sheet apply to every chart you look at, but do not generally impact the views of others. So it's important to remember that and to set your face sheet up so you can be at maximum proficiency and efficiency. So let's take our time to go over the face sheet and its individual elements. Face sheet elements can be unlocked by using the Customize Face Sheet option from the dark side on the left. This allows you to select or deselect certain items to be present on the face sheet. If you're adding a lot of new items, it can be helpful to add them in the order you want them to appear so you don't have to move them all around. That said, if you did desire to move elements around on the face sheet, you can move things up, down, and around. We are about to get an upgrade to version 18, and many of these will gain color and different icons. These are generally called the sprocket or opening the widget by this widget icon. And those will look a little different in 18, but the principles are the same. So move your elements around so that you get, particularly up top of the face sheet, what you use the most. So every time you enter a patient's chart, you'll be presented with the face sheet. So things that you want to see should be up top. Flow sheets are things that I enter regularly and are right up top on my flow sheet to provide information about diabetic information, to compare CBC values and chemistries. You'll see that in further training. That said, the widget to open flow sheets allows you to add and subtract flow sheets. Most charts are built with the healthcare maintenance, lab CBC, and lab chemistries. For patients that are diabetic, this generally gets added for you. Same with warfarin, but this is where you would add and subtract. Allergies will be a list of the patient allergies. It can be modified by clicking on the magnifying glass and searching for different drug names. It will drop a name onto the list, and then you can edit the information. In the coming version, there'll be options for severity and some pre-check options for what the reaction is. But in general, you could enter the date if you knew it and the reaction. And any comments. Likewise, if someone tells you that an allergy is no longer active or is in error, that could be removed. That's the basics of the allergy section. The widget can give you some options for drugs in a long list, but the hourglass search icon is far easier. So we'll move on. The problem list pulls in elements of PFISH to your liking and can be organized. Let's come back to that in a moment. Medications. We will spend more time on prescribing medications, both from the face sheet and from notes within the record. However, it can be helpful to know that if you hover over information, you can gain some details of those prescriptions and when they were last prescribed, as well as details of the SIG. You can click on a drug to gain access to prescribing information. The side effects list is actually a rather comprehensive and easy way to come to potential side effects when discussing problems with medications with a patient. The prescription history and when they were refilled, renewed, started, and stopped can be accessed here. And you can prescribe or renew medications straight from the face sheet. The sprocket takes you into a more detailed view. You'll be well acquainted with this, but you can change, refill, or discontinue medications. You can record medications or prescribe new medications from this view and make documentation of prescriptions made outside of our practice. Briefly, you can also go to a medication history that demonstrates all drugs ever prescribed with details of when they were prescribed, stopped, changed, etc. Reason for visit: when a patient is checked in, the chief complaint for the visit appears here, which can be of some value. The task list is for messaging about a patient, phone calls, lab follow-up, etc. There will be separate conversation about managing tasks. Suffice it to say that entry using the sprocket takes you to the task list for this patient. And I'll give you a brief reminder that sorting by date can be the most valuable to bring the most recent tasks to the surface. So moving down, the last 4 vital sign records are provided here for you. And the sprocket here can provide additional information, including BMI, the prior trends, and can allow you to add and subtract vital signs. This is fairly self-explanatory: systolic, diastolic, heart rate, respiratory rate, O2 saturation. The newer version is also going to have oxygen flow rates, which will be helpful. There's an expanded details button I'll draw your attention to, so you could document positioning, body site, laterality, cuff size if desired. And there is a mechanism by which you can enter orthostatic vital signs. Moving on, orders tracking. This is a list of the most recent orders for the patient, as well as their status. I hope you'll pay attention to this flag in the chart that says overdue orders exist, which correspond to orders in the chart which are overdue. The sprocket takes you to a list of all orders. You could look back on orders that are overdue, undone, and you can sort, bring all the ordered tasks to the top of the list. There'll be more on ordering in the future, but please remember that this list is a valuable place to come to try and reconcile overdue orders, which come with this little flag here. The patient care team allows us to make a list of other providers that help care for the patient. The search applies only to providers that are listed in our care dictionary. So if they're not found there, you can enter them by hand here. They can be made active or inactive, moved up or down, and saved for the record. So keep that up to date. Immunizations gives a list of the past immunizations given, and the sprocket gives you a view to demonstrate which might be due, what the schedule is, and they are actually documented here as well. But for providers, this is the quickest place to come and see what might be due. On my face sheet, the general PFISH elements are clustered together down closer to the bottom. Past medical history items are here. It's important to note that special details can be contained within, so the last pulmonary function test, or that they were diagnosed in 2001. As much as we can enrich this data, the better. You'll also see that there's an option to remove issues that are either duplicate or wrong. Adding new problems can be done using this local search. So we'll add hypertension. Please make selections that have both ICD-9 and ICD-10 codes associated with them. And you could give a date, either general or specific. So that's how elements can be added to the past medical history. The same can be done with past surgical history. And then these elements that are in bold are contained on the problem list. Now, the problem list is pulled into each progress note, so keeping the most valuable items and active items on the problem list is important. So this sprocket takes you to the Health and Habits History Wizard that has 2 sections. So you can add and subtract problems off the problem list. So I want to put hypertension on. But if insomnia is less a problem, you can take it off. But if you switch back to this view, you can see that it's not alphabetical, but I can highlight this in yellow with a click and then use the arrows to move things up and down. I like to cluster my cardiovascular risks together and those comorbid illnesses with diabetes, things that I'm seeing the patient for regularly, are kept up top. And I'd like to remember that they have hypothyroidism, but that and depression and reflux tend to fall lower on my list. I encourage you to keep your organized problem list by coming and using these displays. So that's how the problem list is maintained. We'll move back down here. Past surgical history is pretty self-explanatory. Social history, it's easiest to come into the wizard, and all charts need a tobacco status. And I'll draw your attention to the requirement for defining a user status. Use the amount used, start and stop date information, and click OK. There are more detailed use of other substances, education, some advanced directive information is kind of tucked in here. Exercise and habits are all tied under social history. Family history, you search just as you would for past medical history, and then define what family members and their ages, when possible, have those conditions. At the bottom of my screen is a list of referrals and their status, and we'll have a section dedicated to placing referrals in the future. But this is the face sheet. Remember that you can move items around to your liking. You can organize it how you like to see it. And this is the view I have for every chart. So I get very familiar with where I find information and can find it very quickly. This is the same information that will populate a note if you want to open up all PFISH elements. So I keep my face sheet up to date when I see someone for a physical, and then I transfer that information into my notes. We'll see that in the sections on documentation, and I hope it's been helpful to get used to the face sheet.